In my day job, I am the director of the campaign to end AIDS at Positive Impact Health Centers, which is an HIV service organization based here in Atlanta. And as a part of that work, I was one of the key facilitators of Atlanta's Ending the HIV Epidemic planning process. And as you know, one of the key cornerstones of the Ending the HIV Epidemic strategy for the country is around increasing PrEP access. Outside of my official duties at Positive Impact Health Centers, I also had the pleasure of serving as the co-chair of the Stigma and Disparities Subcommittee of the Presidential Advisory Council on HIV/AIDS, where one of my key areas that I wanted to bring attention to was the need to have more equitable PrEP access. One of the projects that I worked on was actually talking to young Black gay men here in Atlanta, but also in Jackson, Mississippi, about their concerns about PrEP access. And some of the things that I heard from the interviews and focus groups that I did with these young men were that most of them had heard about PrEP, which is no surprise. I think PrEP awareness is very, very high. But what I did hear from a lot of the young men is that if they had friends in their networks who had a bad experience with PrEP, or more commonly, they had a bad experience with a healthcare provider or a healthcare institution that they went to in an attempt to get PrEP, that really hampered their willingness and their desire to kind of go through with actually getting on PrEP. What I mean by that is many of these young men talked about going to a medical appointment, asking the provider about getting on PrEP, and then being discouraged by the provider saying like, oh, you don't need to be on this. Why do you need to be on this? When at that point, the person had actually made the decision that he wanted to be on PrEP, and to have pushback from a provider who's supposed to be facilitating that access is, that's a major barrier that has to be addressed. PrEP should be available to people with health insurance with no out-of-pocket costs. An area that I really want to see us do more work in is around demand creation. We know that a lot of the existing campaigns that talk about PrEP are not really tailored to the lived realities of many Black people. And if we're going to really increase uptake and access among this population, we have to make sure that we talk about PrEP in the ways that are commensurate with the way that people live their lives. And so I feel like that's a growth opportunity for us as we think about building out this national PrEP program, where we need to devote a lot of our resources. Making PrEP something that people know about, but also that they know about it and know where to get it and how to navigate the system. I think if we're going to end the HIV epidemic, we have to do things that we haven't done before. And one of the things that we have to do is create better systems. The National PrEP program is poised to be a better system that will help us create the changes that are necessary to get us towards the end of the HIV epidemic. So PrEP is such a vital component of that overall strategy. And I fear that if we are not able to dramatically increase the uptake of PrEP, specifically among Black communities, we will not be able to end the HIV epidemic. And so we have to do all that we can to do things that are novel, innovative, powerful, and different than what we've done in the past if we're going to be successful. And that's why I'm strongly in support of a national PrEP program.